Hey guys, good morning. It's the Fly Foot Doctor. Definitely looking different today. I'm getting ready for work, and as I was getting ready, I'm going to be doing a bunion procedure today. And so I thought, why not shoot a video talking about bunions, because I get asked this question a lot. People are asking me, hey, either in my office or online, what are bunions, what causes them, and all of that stuff. If you don't know me, or if this is the first time here, hi, I'm the Fly Foot Doctor. I'm a foot and ankle surgeon and doctor who practices in Houston, Texas, working for DeNiel Foot and Ankle Center. All right, so today what I want to talk about is bunions, essentially. I'm going to talk about what bunions are, what causes them, can they be fixed, all right. So what bunions are, what causes them, can they be fixed? Are there things that we can do to try to reverse them? What surgery's like? Do we need surgery? And things like that. And if there are things that I don't cover during this little talk while I get ready, please let me know, leave a comment down below. If you enjoy this content, if you enjoy this style of content, which is while I'm getting ready, because I just haven't been able to sit and do content for a while. And so I think this has been the best option. I just thought of it. I said, you know what? While I'm getting ready for work, I'm killing two birds with a stone. So I'm just going to try to do this. So let me know if this works for you, and we'll go from there, okay? So what are bunions? Bunions is that bony prominence that you see on the, inside of your foot is what people say. But essentially, it's a bony prominence. So it is not just soft tissue. It is not just skin. It really is your bone that is protruding out that area, okay? It's protruding out, and what happens is the bone, which we call the metatarsal, the long ones, it starts to shift. It starts to shift outwards, but the big toe remains in place. And so all of a sudden, this big bone is shifting outwards and the big toe is in place. And then you turn up with something like this. And the more it shifts, of course, the bigger your bunion is. So one of the things that I've gotten asked, is it just soft tissue? No, it is not soft tissue. It's actually bone. Now, there are ligaments and tendons all around that joint, but essentially, it is just the head of the metatarsal that is protruding out. And sometimes with changes in activity and things like that, that head actually starts to get bigger than normal. Okay, so let's see. I have a note here so I don't forget. What causes bunions? Now, bunions can be caused by a different set of things. Now, people will say, oh, shoes causes bunions. What shoes do is they make it worse. If you were already going to have a bunion, when you wear shoes that are tight and narrow and push your toes together, so your toes are usually, or your foot is usually like this, nice and straight, but then you have this as pushing these toes together. Remember I talked about that big toe being in place and the metatarsal behind it going out? Now, if you're pushing this together, all of a sudden this can then start to push that metatarsal out. And then look at what happens. The bunion gets bigger. But it's not, the shoes made it worse, but likelihood of you having it was already there. Another big thing is, talking about likelihood is genetics. So that means if you're, sorry, I'm trying to make sure that I at least look normal as I go outside. If you're a mom, if you're a grandma, if a family member, usually it's from the maternal side, has a bunion, then likely you may have a bunion as well. So, check your family members and see if there's anyone that has a bunion. Now, men have bunions as well. I have, my dad has a bunion, my brother has a bunion. So men have bunions as well, but a lot of the times their shoes are not as narrow, so it doesn't bother them as much. But yes, it does have a genetic factor to it, so that's something you should consider as well. I'm mixing two different foundations, so I know I look crazy, but it'll work out, I think. All right. So we talked about genetics. We said shoes make it worse. The next thing is your foot type. So if you look at your foot, and you have flat feet, that will also make it worse and make you have a bunion. And what is happening is when your foot is flat and you are what we call pronating, like you have no arch, this bone again starts to become hypermobile. It's moving, and now it moves in ways that we don't want it to move. So again, it starts to move out. This big toe stays in place, and look at what's happening. A bunion. See that? Because it is hypermobile. So if you have a flat foot, that can also cause you to develop a bunion. You know, you were born with flat feet, you didn't have a bunion at first, but you started walking, you started moving, and then you then developed a bunion. So that's something that could happen as well. So flat feet, genetics, the types of shoes you wear, sometimes arthritis. And so what is arthritis? When you lose cartilage in your joint and your bones start to, you know, they go in ways that you don't want it to go. So arthritis could cause it too. Arthritis could cause bunions as well. Any kind of arthritis, they could also cause that joint to behave in the way that you don't want them to behave, okay? I need this to dry a little bit because it's a little too thin. So these are most of the common causes of bunions, all right? So let's see another question that I got asked. What are the symptoms of bunion? So symptoms of bunion is pain with shoes, pain, of course, in that area, causing discomfort. You can't wear shoes. If you wear sneakers or shoes that are tight, they cause discomfort. So you either have to wear sandals or open-toed shoes to kind of help you. So those are the symptoms that patients will feel. Now, sometimes patients will just deal with that by not wearing those shoes, right? But some people even feel pain even when they're not walking. They're not moving, they're just sitting in bed. They also will feel pain. So that is some of the symptoms. Again, it's just pain in that joint when you're moving and it's causing you a significant amount of discomfort. Can bunions be reversed? Yes, but I think I'm gonna leave that question till the end so we can talk about how they can be reversed. What are the best treatments for bunions? Well, the best treatments for bunions are surgical treatments. So again, we're going to talk about that at the end. Do they hurt all the time? No. So bunions don't hurt all the time. And if it doesn't hurt, I mean, then it's just that you have a foot that looks, you know, the way it looks. You don't have to fix things that don't hurt. If you want to fix it because you don't like how it looks, that's different and that's okay. But do they hurt all the time? No. And do you have to fix it? The answer is no. Let's see. Can bunions be treated without surgery? When you say treated, so that's where we kind of say, what do you mean? I'll kind of lump that would kind of be reversed. You're not going to get rid of the bunion by using any of those gadgets, or you're not going to reverse them by using any of those gadgets. And, you know, check in the description below. I will link some of those gadgets that we're talking about, and I will let you know when and I think those gadgets come into play. What are the best shoes? So when I am advising my patients for shoes, I tell patients you need to get a shoe with a wide toe box. A wide toe box. And what does that mean? A wide toe box shoe is a shoe that is not narrow at the top and gives room for your foot to breathe, so it's not pushing your toes together, because we just talked about that big toe is standing here, and if it pushes this metatarsal, look at what happens when it pushes it. So you want something that's not pushing it, because the more it pushes, it'll push. See the bunion's getting bigger, getting bigger, and now we just look like this, okay? So you want something that you have a wide toe box that can accommodate the widest part of your foot. Very random question. I'm wearing pink. Is this a fuchsia pink? It's kind of like a mix between baby pink and fuchsia pink. I don't know. And I don't really have pink. I think I'm gonna use this palette for my eyes. So it doesn't matter what, well, it does matter, because you don't want to wear shoes that are too flimsy. You want to wear shoes that are, you know, feel a little firm. So firm shoes are the way to go, not flimsy shoes. Shoes that have a wider toe box, that is what you want to wear. That kind of gives a good accommodation to your metatarsals. What happens if the bunions are left untreated? Nothing. If it's not hurting, like I said, you don't need to do anything for the bunions, okay? If it's not hurting, leave it alone. If it is hurting, then that is when you need to see a doctor. If it's hurting, if it's affecting your choice of outing or activities, like, hey, I can't do this because my foot hurts. I can't do this because because my foot hurts. If you're now making decisions based on the fact that your foot is hurting because of your bunion, that's when you need to see a doctor, okay? So to answer that question, when to see a doctor, if you're having pain, if you're having discomfort, or honestly, another reason is if you just don't like how it looks. If you don't like how it looks, fix it. You know, science and technology has gotten to the point now that we don't have to wait to fix things that we don't like. If you don't like it, fix it. I mean, and we do that all the time. So pain, discomfort, things that are pain that is affecting your choice of living, and just, you know, aesthetics, you can do that. What is bunion surgery like? So there are different types of surgeries that I specifically do, and it really depends on what you have going on. It's not a one-size-fit-all surgery. If you present with something that's mild, I won't do a surgery for you if your bunion is not like, you know, super big. So if your bunion is just a little bit like this is a mild bunion. If it's like this, that's about a moderate. If it's like this, that's, you know, severe, clearly. And so there are different things that we would then need to do to fix that. So it really just depends on what you present with. Now, what does it look like? I typically do minimally invasive surgery now because, again, I like aesthetics. I like things that look pretty. And so my goal is to make incisions as minimally as possible. Don't get me wrong, I have done the long incision. I mean, I used to do that years ago. And in some cases now, I may still do it, but I am definitely getting away from that now. Okay, so we do minimally invasive surgery. Depending on the kind of bunion you have, there are surgeries that we do that you can walk right away and you don't have to be, you know, down and out. And there are other surgeries that we do where I may put you in a boot or something for a few weeks just to kind of let things solidify. If I have to do more work and I want things to heal a little bit more, then I may do something like that to just kind of give you, you know, some time to get better. And there's some that I may have to, like in this one that is super big, I may have to shift the entire bone because look, when you shift the entire bone, it straightens up. So it just really depends. There's, you know, pain, of course, that comes with that. But we give you pain medication. We always worried about infection, so we give you medication to help with infection and reduce the chances. Now, the minimally invasive surgery we don't do. I try not to do any hardware, but sometimes, again, if it's a super big bunion, then, you know, I may have to do a shift with hardware. Let's see, can bunions come back after surgery? Yes and no. It really depends on the kind of surgery that's done. All right, hold on. Let me blow real quick. All right. It really depends on the kind of surgery that you do. So if you have a severe bunion like this and all you do is shave that bump, guess what? You have not fixed the foundation. So it will come back. I have to do this real quick. Okay, so I finished my lipstick off camera, I guess. And I usually would do lashes, but honestly, I am running so behind right now, so I don't have time for lashes. So I'm just gonna have to go like this. This is how I'm gonna go. Oh, I'm just gonna wear regular earrings. All right. So what was I talking about? Will it come back after surgery? Yes, it can come back after surgery if the appropriate procedure is not chosen. So that is something that you want to make sure that your surgeon is knowledgeable and knows what they're doing and has done, you know, quite a lot of this with experience and, you know, with procedure selection. Can bunions affect your balance? Not typically. So bunions will typically not affect your balance, so I wouldn't worry too much about that. Again, pain, making you make decisions that you would normally not make because of pain, and then if you just don't like it aesthetically, then those are the reasons why you would fix it. So I talked about some of the things that you can do. So those little bunion gadgets that they sell, those work much better after you've done a bunion. So if you've done your bunion surgery, those will work to keep your bunion straighter, because remember, you're still healing. It takes a while for your body to get better. It takes a while for all the ligaments and tendons to improve and kind of get, you know, enjoy their new position. And so it is definitely advisable to use those bunion splints after surgery. Now, if you don't want to have surgery, I mean, are you doomed? No. So things that you could do are, bunion sleeves. And again, I'll link them down below in the description box. So be sure to check that out. You could do bunion sleeves. You can also do orthotics. Orthotics are my go-to because they help you when you walk, especially if you have flat feet, right? They help you after you want to go to a doctor that can do something that's customized to you. And if you are unable to get to a doctor, again, I'll link down below where you can pick up some orthotics from Amazon. These are affiliate links, so there is a commission if you pick up anything. But again, you can pick up either there or go to your doctor or anywhere, okay? Now, when you're picking up an orthotic for a bunion or flat foot, you want something that has an arch support, okay? That supports your arch because, again, if you have flat feet and your arch is completely collapsed, you want something that is sturdy enough to hold it up, because what's happening is if that collapse, look at this, so I assume this is the ground, with that collapse, when it presses, you see how it moves this first metatarsal, because again, it's hypermobile, it moves it, and so moves it out. So you want something that is already, that kind of supports the arch, which is back here typically, so that this one is just not moving any kind of way. All right, so bunion sleeves, arch support, orthotics, topical anti-inflammatory that you can pick up over the counter, or anti-inflammatory that you can pick up over the counter. Those will help as well. Shoe modification, meaning wearing shoes that have a little bit of a wider toe box and not something that is super narrow and causing, again, that shift. So these are ways that you can fix it. So this is going to be the end of this video. I covered quite a bit of things, I think, but maybe there's something I didn't cover that you were interested in finding out. Please leave a comment down below and ask me. If you're new to this channel, welcome. I would love for you to stay and watch other videos. If you want me to talk about something else related to the foot and ankle or just general wellness, health, let me know. Leave a comment down below. Follow me on here and all my other social media platforms on TikTok, Instagram, as well as on YouTube. It is the Fly Foot Doctor. It was a great pleasure doing this with you. Let me know if y'all like this style of video, like getting ready, and this way I think I can actually make videos as I get ready, because now I'm done and I don't have to worry about it. All right, anyway, till next time, I'll see you later. Bye.